Good morning and welcome back to it, the Now Morning Show, where our very first guest in the spotlight is telling us about the UWI and TTMA Presidential Symposium happening on the 14th of January, exploring the theme Visionary Leadership in Medicine. And to do that, this morning, Dr. Marisa Nimrod joins us to tell us a little bit more of what we can look forward to on the 14th. Good morning and welcome back.
Good morning. Thank you so much. Season's greetings to you both.
Right, season's greetings. Just that I keep forgetting to say it. Thank you for reminding me. But this is season to explore, well, we are talking about leadership in medicine, and we definitely need vision as we head into the new year. So this year, what can we look forward to on the 14th?
So great. So this year has been a very eventful year coming out of COVID. So definitely that transition has been one that persons would have, gingerly broken through, etc.
Right.
And we focused in essence on NCDs in particular. So we know that infectious disease, the others that weren't in the forefront was going to be diabetes, high blood pressure, cancer. Right. This year we also focus on blood banking. And the reason that we actually got through this is because of the fortitude and the visionary leadership from not just physicians in the medical fraternity, but it would have been a collective approach to healthcare. So this year, the Faculty of Medical Sciences, under the leadership of Professor Simongal, has agreed to partner with the Trinidad and Tobago Medical Association to focus on engaging all stakeholders, right? So this is going to be a multi-stakeholder meeting with representatives from all hopefully allied health professions, right, including medicine. And we want to get people to come to give their viewpoint or discussion on how to make tangible changes to the way that we actually perceive healthcare.
It sounds interesting. It's wonderful to see the entire community come together at a time like this. Of course, being able to meet again after COVID-19, because as we know, past 2 years, we haven't really been able to interact. And as you mentioned, some of the key things that you focused on, I know with a lot of those things, preventative measures are so important. So what could you recommend for us, perhaps moving into the new year, that can stay in line with that so that we can continue to live our best life healthily?
Love it. So we normally take steps to do two things. For those of us who are healthy, we normally say, that sometimes we just go to the doctor when something's wrong. We ask persons to do regular checkups, and that was something in the past. So at least once a year, get to your physician, even when there's nothing going on. Chances are we want to maintain that good baseline and to also assess if you're at risk or there's a likelihood of something developing a little later. We want you to follow the health rules and the principles. So we know this growing up to eat well, drink water. For those who have some sort of chronic disease, try to take it easy. Christmas is a wonderful time, and as we say, it's gastronomical. We love to eat. We're awesome for food. So again, have a little less, even though it tastes great, and as my grandmother used to say, chew it at least 30 times, enjoy the flavor. So again, I know it's hard to do.
Not happening.
But again, we really want to prevent persons from how do you put it, having a poor quality of life or morbidity. We don't want you getting sick. We don't want you in the hospital with high sugar, high blood pressure unnecessarily, when you can actually take the reins and hold on to it and do something about it.
And it definitely will be in a lot of people's resolutions for the new year. So we are talking about preventative measures, essentially, that they can take forward with them into 2023. Good stuff. Now, speaking of good stuff, one of the events, or part of the calendar of events, I imagine, happening particularly on the 14th, will see the President of Trinidad and Tobago lending her presence. Tell me a little bit more as to how she is involved in this particular instance.
Okay, so yes, we definitely have the honor of having the President herself coming, Her Excellency, and I thought it would have been, how do you put it, a great way to start the year in terms of someone who sits in an office again, we say, you know, sometimes silent leadership. Not everything has to have a voice, but again, someone who can speak to being accomplished in her profession, having her stamp of approval, endorsement, and charging us for the year going forward. So we do have the honor of having Her Excellency, and from supposedly reports, you know, we're quite fortunate to have on the 14th, you know, to start the year off. And that's it. We have a huge cast of persons who will be speaking. So the Minister of Health, President of the Medical Board, nursing, pharmacists, allied health professionals, the principal of UWI, Professor Sumangal. So it's a huge slate. And I honestly believe, you know, that we would like persons, and this is open to the general public.
Right, that was going to be something worth mentioning. It might be a little intimidating for a listener or viewer to hear that they're going to hear from the president and all of these persons at the helm, but it's really going to be for the average citizen to take forward with them into the new year. So that's great to hear. How do they get on board?
For business to get on board, we would like you to actually reach out to us. We are doing the contact through the Medical Association, so you can email us, medasoc, MEDASOC, at tntmedical.com. You can check our Facebook page. You can check, you know, Instagram. Phone numbers are there. And just RSVP. We're looking for at least 400 persons to attend. It is going to be different in that we're going to have focus groups. So we're going to have discussions going on. We want to find out about human resource retention and management. What are some of the gaps in the system? Because as end users, persons in the system, we want to hear what's your experience. How are you? Yeah, exactly. How are you contributing to this? What can we do to improve on it? And that's why the university is taking it from the research side. So this is not a one-off. This is going to be something that will be continuing on a regular basis. We will have all the stakeholders representing, and we're hoping the information that we collect will be translated into policy. So policies is definitely where it's at, which is why the Ministry of Health is involved. So we wanted to connect, obviously, the academic, seat where we're having training and visionary leadership, and make sure that everyone is able to participate going forward. So
that means that the conversations, as you say, are not going to just sit there. They're going to actually roll into actions that we, the people, can receive and actually enact as well. Let's talk a little bit about the future of the average person as well, because as much as Tash said, you know, we have those New Year, New Me plans. Do you have any sorts of tips besides the annual checkups and, you know, maintaining a healthy lifestyle? Are there key focus points that we should look forward to or look at going into the new year, specifically coming out of the pandemic?
So I would say coming out of the pandemic, I think the most crucial one for me would be mental health, you know, and
I agree with you.
I would put that there. I've seen Miss World take it on as a challenge in terms of mental health, and that literally is a huge range of topics, you know. So this is not just dealing with depression, this is not just dealing with anxiety, we're talking work cultures, there's so many other facets to it. You need to have time to do you, to listen to you, to find someone to speak to and confide in, find out what is the chain of command, if it's in your workplace, if it is a family issue, their hotlines, you know. That, I think, is definitely what's been affected. And funny enough, mental health also translates into physical ailments and maladies, you know. So persons come in and the blood pressure is high, and guess what? If it's an elderly person, it's because her children are not calling her anymore. So she's worried and she's upset and her blood pressure is high. She's not compliant with her medications. She just wants somebody to pick up the phone and reach out to her or pay her a visit, or, you know, so things like that. Back in the day, it used to be a brother's keeper and looking out for persons. So I think mental health is so important as the challenge for this year, followed by, as we said, prevention, even when you're healthy. That will hopefully reduce the number of cases for the other non-communicable diseases, you know. So.
And Dr. Nimrod, talking about this year, if we're not mistaken, you are the president of the association.
Yes, I am.
So does this mean that going into 2023, you will continue in the office or no?
No, I have a wonderful successor coming up. So Dr. Damian Basdale is the president for 2023. So he's the incoming president. He's brilliant. president. He's pretty much going to be following along the same topics or pillars that we've been focusing on this year. His inauguration is actually coming up. That's on the 21st, and he's representing the East Branch of the Medical Association. And I would love for persons to lend their support going forward. And even details for his inauguration is on our website. So, so we'd like to focus on the younger leaders. We have the medical students, nursing students, and again, that would be the charge, you know, as we move forward. That leadership involves different facets, which is why we're trying to get this program going. So leadership is not just necessarily, you know, your style being, you know, bold and out there. Sometimes there's silent leadership. There are different qualities in terms of, you know, negotiating, mitigating, you know, what else again? And being able to serve, I think, is one of the most crucial parts of being a leader. If you can't listen, if you can't serve the persons that, you know, are under your charge and learn to navigate, nobody's perfect. You will make mistakes. I've made mistakes. But you learn from there, and you still try to unite, you know, persons going forward. And if health is the most expensive commodity that you have, I believe that we should try to protect that, cherish it, and see how best, as you said, you can be the best version of you going into the new year.
Definitely. Best version of you going into the new year. I
like it. And of course, it's certainly the way that we can all be visionaries, that we can lead, and that we can participate in the upcoming symposium happening on January 14th. The UWI and the TTME Presidential Symposium. You guys, we are going to be able to go to their website to get more information, and of course we, the public, can attend, get the information and put it into action for 2023. For now, we say thank you very much for Dr. Marisa Nimrod for joining us, keeping us up to date as usual, and as much as you may be outgoing, you are always welcome to keep us updated.
I love it.
Thank you so much for joining us. And of course, to those of you who are tuned in, stick around. We've got a lot more great information you can take with you as we head into 2023. Just not on the side of this break. Stick around, guys. We'll be back.